In this week's muscle breakdown, I'm covering a very important muscle for function in the hip, stability of the hip, and overall movement in the hip, the adductor magnus. What's up, everybody? I'm Dr. Matt Maggio, creator of the Peak Method and the founder of the Soft Tissue Revolution, where we teach massage therapists a new treatment method that allows them to easily double their income, all while working 50% less and being taken seriously as a healthcare provider. So back at it for one of my favorite segments, muscle breakdown. And this week we're covering a really important muscle in the lower extremity, the adductor magnus. It's one of my favorite muscles. You know, I always say some of the muscles sound like Roman gladiators, and adductor magnus just sounds like a badass muscle that can really mess some stuff up. And it really is. It's a huge muscle, and it gets missed a lot in hip problems, hip pain, hip functioning, and just overall biomechanics. Now, the issue with the adductor magnus is it sits really deep and it takes up a huge part of the lower leg and the femur as well. And if you actually look at an anatomy of it, the cross section of it is huge, and it is such a primary mover for the hip. It helps drive the hip through space. So you need it for running, jumping, cycling, movement, exercising, and it really gets beat to hell. And when it gets beat to hell, it doesn't get enough blood flow and it doesn't get enough oxygen, so it actually starts to lay down a lot of what's called scar tissue. And scar tissue is like glue that gets inside the muscle, makes it really hard for that muscle to be able to stretch and contract how it's supposed to. And over time, what happens is that muscle can't deliver the force it needs to, so it ends up going to different areas, and it ends up putting a lot of pressure on the tendons in the hip, the joint, and the cartilage as well. So you get a lot of your clients that come in and they get pain in the front of the hip, and they'll say, hey, I get like this pinching or this discomfort. And usually what's happening is that area is getting overloaded because the adductor can't produce the force that it needs to. So a lot of people get misdiagnosed with like a hip flexor problem, and they think it's like a psoas problem or an iliacus problem, and it's not even close to that, and they get the wrong treatment. I always say, if you don't know what a problem is in the first place, there's no way in hell you're going to be able to ever fix it. And scar tissue forms so much in the adductor magnus, and so many people are like, well, I never had trauma there. Like, how in the hell can I get scar tissue? You can get it from overuse. And think about people, you know, athletes, cyclists, runners, they beat the hell out of these muscles, and then the force has to go somewhere. So you got someone with like hip bursitis, impingement, which doesn't really tell us anything, labrum problems, all sorts of things. Adductor can be a big problem. What I wanted to include this week was a treatment of the adductor magnus using what I call manual scar tissue treatment. And the thing you'll see in there is, as we break it down, helps you really find where that muscle is. A lot of times what I find is practitioners are actually not even on the muscle. They're usually a little too far forward on the gracilis, or they're too far back on the hamstring, and it hurts like hell, so they think they're doing something, but you're not actually on the right muscle. So I'm going to link that video up so you can check it out now. We're going to be treating the adductor magnus. Make sure you watch the advanced palpation before, because a lot of times people aren't actually on it. They're either on the gracilis or the hamstring, and when you don't get this right, it can make it very excruciating for your client. Now, the key here is all in the body and the mechanics and everything set up for that. So what I like to do is have it resting right on my hip, because what we're going to be getting is this hip flexion, and you're going to use that to kind of lean away. So after you palpate and you find the area, you want to get in there and get some lotion on it to start, because this area can be very sensitive, but it's very important for overall hip function. Once you identify the area where the scar tissue is, now you're going to get in there and start to do the treatment as well. So you found it, let's say you found the scar tissue right here. We want to go just inferior to it, because this is going to be internal slide. It's going to come to us. So what I do is I see how this is right up against my body in here, and I'm going to get into a stance where I'm facing away. And the first thing you're going to do is you're going to back these thumbs up. So come in a little bit closer for me. So what you're going to do is back these thumbs up. This is going to allow me to get my depth and my tension. So the first step is I'm going to get my depth by leaning in with my body, just like that. I'm going to come out just a little bit, and then my tension is going to be rolling my thumbs just like that. That area is loaded up, and then what I'm going to do is take this other foot and step that back, and I'm going to go nice and slow and let that come to me. I am not going to slide. I'm just going to be very precise and let that come through. And you want to go nice and slow with this treatment as you do that. Get this leg in your hip. It's going to help you take some of that pressure off your hands. And the key here is you're going to reach with this opposite foot in almost like what's called a fencer stance. So when you finish, you're going to end up like this. So I'm going to show you the way the motion looks. So I'm not going to do the actual treatment part here. I want you to see the body mechanics. So we sink, we're in, I step this way, and then I lean away like that. And I can really, when it's a really bad area of scar tissue in the adductor, I can lean my body in there and get some of that increased tension in there. So the key is getting that motion first, but taking the time when you start to find the area where that where that scar tissue is. And if you're still learning, getting it figured out, draw a little marker in there too. It might help you kind of line it up, because if you did all the work to find it, but then you're thinking about the mechanics, it's going to mess with you just a little bit. But this area is very important, and the key here is using your body and using your weight to allow you to get the rest of that motion in there. So I hope you got something out of watching that video and seeing the idea that you need to be precise and very focused with your treatment. So much musculoskeletal treatment out there is what I call like a shotgun approach. They just treat a bunch of shit and kind of see what happens, and they never know where to really go. In the peak method, what we really train is more of like what I call a sniper approach. We figure out exactly where the problem is. We know with palpation we're going to find it, and we get right in there and actually fix it. And you see that the key to breaking down scar tissue is proper depth, backing off a bit, then tension, and having the client go through a full range of motion. But if you can't find it in the first place, you sure as hell can't fix it. So hope you guys enjoyed this video. If you have any specific muscles you want me to cover, send me a message. Always here to help. We do have free training going through my entire system, the peak method, and it really does back up the claims that we talked about. It does help massage therapists get taken serious as a healthcare provider. You can cut your treatment times in half, and you can sure as hell make a hell of a lot more money without working harder, but actually working smarter. All the information to that is in wherever you're consuming this. If you like it, give it a comment, a share. If you didn't like it, then don't do those. And I appreciate you guys watching, and we'll see you on the next one. Bye.